So I guess it's good afternoon. It feels like it's good morning, but it's good afternoon. Thanks for joining us today. Today we're going to cover Standard 8, which talks about health services. Um, but before we jump right into that, we are first going to talk about some things, or I guess one big thing that is new and changing with the Iowa Family Support Credential. And so I wanted a chance to talk about that very briefly, and just know that there'll be more information about this. It's already been released, but there'll be more information coming. Um, Maybe. There we go. So, um, all right. So let there we go. The initial conversation went out regarding the annual fee for the Iowa Family Support Credentials starting July 1st. It's going to apply to all programs that currently have the Iowa Family Support Credential and want to continue that, but also programs that do not have the Iowa Family Support Credential but are starting TA um, to prepare to earn it for the first time. So any program that's in TA or starting TA to earn the Iowa Family Support Credential, and then every program that currently has it to keep it active will that fee will apply to. The fee is going to be based on the plan service capacity, which is determined by the funded capacity of the program from all funding sources. So I know we have a lot of programs that are funded by ECI, so it would be that. But then we do have a lot of programs have some supplementary funds from like United Way or other sources, and so it would be a combination of all of those funding sources would be what the fee is based on. So basically, your total plan service capacity for the program is what determines that fee. The Iowa Family Support Credential, myself in conjunction with IDPH, will determine the fee based on the information that's reported to us on an annual update form each year. That form will be sent out every July. You're required to complete it and send it back by July 31st. And then that's how we know how much to invoice you for. And so you'll get that invoice, and then it will be payable by, well, I think we go into that on the next one. Oh, maybe not, but it's payable by December 31st. And there'll be lots of communication about, reminders and invoices sent out and those kinds of things. So there shouldn't be any ambiguity about when it's due, how much it's due, where to send payment, all of that stuff. That'll all be communicated. So as a continuing participant or a program that's credentialed by the Iowa Family Support Credential, we're kind of changing some things a little bit. Before it was you only got TA, in that year leading up to a renewal or as you're working on your initial credential. But now you'll get 5 hours of individual TA per year, which would include years when you're not actively participating in the renewal, when you're not in that last year before renewal. So, if you are, you recognize that there's something that's not quite working regarding your assessment policy and you want some feedback about how, some things about that, you want to run a policy past us to see if it meets the standard before, putting it in place, anything you might want to talk about, 5 hours per year. And that's, that individual TA. So, it might be with Leanne, it might be with me. It kind of just will depend on who is able to take it and who's got some free time to offer up. But it could be either one of us. It also allows you to continue participation in these monthly webinars, which we will continue to do. Those quarterly newsletters that will be highlighting changes to the standards, new policies, updates on best practices, or new resources and tools as that we add them to the toolkit. We'll be updating the Iowa Family Support Credential toolkit over the next several months and to the next year. And so as those things are rolled out, those will be available to you as well. And then we're looking to, and you'll kind of see this here and very soon as the next newsletter comes out, working to expand our newsletter, what's included in the newsletter, and to kind of bring it into this modern century, and make it more user friendly and contain information that'll be useful to programs. And then it also allows you to participate in trainings and professional development as offered by the Iowa Family Support Credential. We used to do that several years ago. There was more trainings and PD opportunities that kind of went away for a period of time, and we'll be bringing that back coming in the next coming years, whether it be something that I'm training, whether we recognize that there's a need across the state and we decide to bring in somebody to train that, somebody that's an expert in that subject matter. It could be really anything, but those opportunities will increase as well. So here's the matrix. And I'm sure, like I said, most people have probably already seen it, but here's what the matrix looks like in terms of that planned service capacity. It's right here with 25 or less, 26 to 99, and 100 or more. Supplies to both home visitation programs and group programs. I do want to kind of point everybody towards the full policy, because there is a lot more in the full policy that I haven't covered here, kind of nitty, like specific details. So I would point everybody to our website to take a look at the full policy if you haven't already seen it. And then I would kind of add too, if you're with a program or organization where there's multiple programs operated by one organization, or one program operated by multiple organizations, definitely take a look at the policy for additional information about how the annual fee will be structured. There are some, you'll be requested to declare what type of peer review you want, whether you want a combined or a separate peer review, which does impact that annual fee amount. So you'll want to take a look at that. If you have questions about it, reach out to me. We have changed our email address, so you can email me directly, but you could also email into our generic email inbox that comes to both me and Leanne. And that way, if I'm out of the office or I'm on a peer review or something like that, you'll get a response from the other one, or vice versa. If Leanne's out of the office and it's me, and you can, I'll be able to respond to it as well. We both check that inbox. But it used to be the IFSTAM program at lsiowa.org. It's now IFSC program at lsiowa.org. So if you have the old one in your address book, just make sure to update that. Okay, so I'm going to pause there and see if anybody has any questions before we actually dig into Standard 8. I know, Sarah, I know I saw an email come through for you, but I don't want to pause it and pull it up. Is there can you hear me okay? Are we having a technology issue, or is something else that you need me for?
Oh, I can hear just fine. That was a separate email.
Okay, cool. All right. I was just like, I wasn't sure if it was related to this or related to something different. So I wanted to check in with you. Cool. Does anybody have any questions about that annual fee? Or anything you want to talk through? All right. Well, if you have any questions, you could think of any down the line, or as you're looking through it and reviewing it with other people, definitely reach out. I don't have the exact date off the top of my head. I do know, I do know that there's going to be a webinar. Christy Russa with IDPH is going to be, hang on, I can't do two things at once. So Leanne, could you get that person in the waiting room here? What was I gonna say? Oh, I'll get it.
I'm sorry, it's not showing to me.
Oh, that's weird. Okay, never mind. I got it. It's no big deal. What was I just saying? I don't remember. If you have any questions, reach out. I will definitely get those answered for you. Oh, Christy's having a webinar on, I don't have the exact date off the top of my head. It's like March. It's in March. Anyway, I will send that out with the slides as well, what date that is, so that, and the link for joining that meeting. I actually don't know if that link has been sent out yet either, but I know it's coming. So even if you don't have questions right now, I would definitely encourage you to join that meeting, listen in on it, hear maybe questions that other people have, and maybe that'll make you think of something, but get as much information as you possibly can about the changes that are coming to that, because there are new things, new processes to roll out, and I want to make sure that everybody has all their questions answered or has an opportunity to ask all of those questions. Okay, so as we move forward, we're going to start where we always start on all of these webinars, which is kind of that description and kind of to set the tone for the definition between policy and procedure and what we're looking for. So if you'll remember, policy is, broad application, general guiding principle, typically kind of gets at those statements of why or what. Doesn't change very often. And, depending on your organizational structure or program structure, would be those things that are approved by the board, kind of those higher level pieces that speak to that what or that why, which is why a board, they may be approved by the board. Procedure kind of gets a little bit more narrow in their application. It's describing specific processes or protocols, answers questions like how, when, sometimes who does what role, what position does a specific thing in, that's outlined in that procedure. Probably going to change more often, as you recognize that, hey, this isn't quite working the way we thought it was, or maybe a job description changes, and so you need to update some things in the who does what piece of that procedure. They're prone to change more often. If you do have that board approval part of the process, then it doesn't necessarily need board approval. These are more, like I said, just little tweaks on how you do things. And that's why they might change more often, or as funding changes, as curriculum changes. There could be, whatever those changes might be, definitely could spur that change that needs to be made. And then as we go through all of these webinars, we talk about each thing separately. We talk about policy, we talk about procedure for each standard. But on the ones that we're getting at procedure, and I'm trying to get better about highlighting those procedure kinds of conversations and discussions, we use this procedure boost, which is just kind of like your clue that this is like kind of that above and beyond, or not, that's not quite the right word, not above and beyond, but like this is the procedure piece. I think that programs we've done a lot of work over the last several years on policy. And so procedure is that piece that maybe historically has been answered in panel interviews, but now we want to move into like getting it on paper, documenting it, and including that as part of your policy and procedure of how what your program does to meet that standard and how it's done. The other thing I want to bring everybody's attention to is tracking the revision dates on policy and procedures. And this is required for participation in the expedited renewal process. If you don't currently have system in place to track this, definitely want to look at doing that and putting that in place soon, very soon, because it's a requirement for the to participate in expedited renewal. So if it's not currently in place, get it in place. Otherwise you won't be able to participate in that. And when you're applying for renewal, we want to see what system you've got in place. So you'll need to be able to show what you're doing so that we can say that that's being done. And you can do it one of two ways. You can have something like this top piece at the beginning of every policy or procedure, which again is tracking that dates of revision. Or you can track it outside of the actual policy itself in like an Excel document where you have the policy name, the effective date, and the dates that it was revised. To me, it doesn't matter how you do it. I just need to be able to see that it's being done. And there's some mechanism that you have to track that, and so that we can look at that. Because the reason it's important is in a renewal, an expedited renewal, one of the things that's included in the review is any policies related or any standards related to policies that have been updated since the last peer review or last renewal. And so we need to be able to know what that is. And we don't want to have to guess at it. We want programs to be able to look at something and say, yep, we've revised our assessment policy and we've revised our our policies on what the structure of our group opportunities look like. And so those are the ones we need to include in there as well. It tells us what standards need to be added to that expedited renewal because the policy has been changed since the last peer review. All right, so digging into standard 8. At the first order level, the standard says families are linked to health services that promote positive child development and the health and well-being of all family members. So we're really going to be talking a lot about health services, linking families to health services, determining the needs of those families, and then making those referrals and those linkages and what that all looks like. So we've got a couple of definitions that we want to make sure we're clear on first. First, the definition of a family, two or more individuals or network of individuals who assume the obligations, functions, and responsibilities essential to the health and well-being of its members. The really important piece here, the takeaway piece is individuals and families may define their own family. So they can include extended family members, significant others, close friends, current or former foster families, adopted families. It's important for us not to make that assumption on who is the family, but rather that the family defines it. And then the other one is connected. And in this way, we're talking about connecting. I guess I should have had we're talking about connecting a family to a health service. So it's the means by which an individual access service that may or may not be provided by the program or organization itself. So connecting could mean that you're connecting them with someone within your own organization that provides that service, that health service, but it could be with outside that organization as well, to a pediatrician, to a clinic, to a medical coverage, to medical home. It could be anything, but it's that connection. So standard 8.01, children and families are linked to the following health services as needed. And we have several bullet points here, which I don't feel like I need to go through all of them and describe what they are. I think they're pretty self-explanatory. I will point out that the interpretation down here regarding element C, which is the mental health care, expectant and recent mothers should be regularly screened for depression, informed about postpartum depression, and connected to available support and treatment services. So this is calling for some sort of screening for depression, talking about what postpartum depression is, and then if necessary, connecting to those support and treatment services. That's relatively new. For programs that haven't renewed in the last couple of years, you definitely want to go back and check, because it was added in 2019 version of the standards, I believe. And so if you aren't doing that, you want to be thinking about how you can get that in place now so that it's there and it's ready to go. Well, I guess the next one is, so we've got the word regularly here described in the standard. And so in terms of definitions for this standard, again, we've got connected down here, but we also want to define what regularly looks like. So your policy or procedure needs to define that for staff, so they know what that looks like, how often they should do that, so that the peer reviewers know how often to look for it in the participant files. There needs to be some definition. So occurring at a fixed, uniform, or normal interval, program should define in policy or procedure the exact frequency that the action is described in the standard. Peer reviewers should be able to predict when it's going to happen next. And I think that's the biggest kind of check. Both, you can use it yourself. We use it in TA. Peer reviewers will use it too. Is if the word regularly is described as it should be, and we're looking at a participant file, how will we know when the next one should be? If we say it's going to be done every 3 months, that's pretty easy to say, to know, or to be able to predict. That's a good question, Amy. I'll get to that in just a second here. And so or if you use, quarterly, and you can kind of go through and say, all right, January, February, March, yep, there was one done. I know that the next one is going to be done in April, May, June. Yeah. So you can kind of know when the next one's going to be done. That there's sometimes when we will see a definition in there for regularly that really doesn't tell us when the next one's going to be done. Phrases such as like, as needed is a really big indicator that I don't know when that need is going to come up again. How could a staff member, be able to anticipate when that need's going to come up again? How would a peer reviewer know when to look for it again? So as needed does not meet that standard. We want to provide some additional clarification there. Yeah, Amy. So Amy asked that she appreciates the definitions being included. Is there a glossary? So not right now. For some things there are that are out there and available right now. There's a document on our website and that we use in TA that's it's I believe it's like if stand definitions or it's something like that. And that one does talk about the word regular on the standards. This is something that we've been talking about for a while now. Um, so yes, there is. We're working on a more broad, definite or broad. We're actually calling it a glossary as well. It's not quite ready to be rolled out yet, but it's coming. So when that's ready to be rolled out, you will all definitely know, which I think will be very helpful on those definitions, exactly what we're looking for, and then especially on these pretty specific things like one of the other words that we talk about a lot is timely. Just describing in the policy and procedure that timely or regularly is another one. I'm trying to think. There's a couple more that are like time oriented based words, and so we have in the glossary those clarification on what exactly we're looking for there. And if you have questions on that, the other thing I bring up is you've got that TA, that 5 hours of TA that'll be starting for any program. So if you've got something like that you're like, in the meantime, before or anytime really, but if you want to know what something means, you needed help on an interpretation of a standard, definitely you can reach out on that. I guess I could say that on that 5 hours, when we document that, we document it in intervals of 15 minutes. So if you ask a quick question, that's just 15, it only takes us 15 minutes to answer. That's only 15 hours. We're not going to take a whole hour just for a quick question. So we want to definitely be good stewards of that whole 5 hours and make sure you get all of it. We're not going to, for one question, say it took an hour. We want to, it only be 15 minutes. So, okay. So digging into policy on 8.01. Policy, we're looking at what does the program do? Why does the program do this? So specific things, describe all the kinds or types or categories of health services children and families are linked to for your program. At a minimum, you want to address all of the bullets in the standard, but more could be included. That is certainly not a fully comprehensive list. If there's other things that your program does and is appropriate to add in there, absolutely use them or include them in there. Make sure to address the depression screening. Make sure you've got that included in there and that there's a mechanism for that element C in the standard. And the other thing I would add is link does not mean just telling the family about a health service. It includes, complete follow through. So there's always going to be that time when you make a referral or you tell a family about something and they're like, okay, we're good. I'll take care of it. I'll call them. But you still want to follow up on that, like at the next visit, and then document that happened. There's sometimes that a family might need a little bit more help accessing a referral. And so maybe you need to have a release of information filled out and you help them access it that way. Maybe it just means you're sitting with them at the home visit and you call right there with the family. And so that you're able to help link things, link them easier that way, whatever that might mean. Definitely though, programs should have a plan in place for, helping the family access those health services and then documenting that as well. I see, if you make a referral, there needs to be some follow-up on, did the family accept it? Did the family access it? What that looked like. There should be some continuity there to describe that entire process. Whether that could be, in case notes, it could be on a referral log, it could be on a contact log. There's lots of different places to put it. But definitely that follow through on what happened. Because it's hard to say a family was linked if it was just like, hey, I gave them information about this clinic coming to town, this dental clinic that's coming to town. Is that really linking them? I mean, what? Just telling somebody about something. I don't think that fully meets the definition of the word linked. So I do have some policy examples in the slides. I'm not going to read through them. One, I don't like to read a slide. I think that's boring. And I think everybody's capable of reading them. When we send the slides out though, if you want to look back to them for reference, you certainly may do so. Some of them are rather lengthy because these standards just happen to be lengthier standards. So yeah, I'll skip through it, but know that they're there. And when we send out the slides, you can look back to them. So then 8.01 procedure, like I said, we're going to break them down and describe kind of what is considered policy, what is considered procedure. I don't, for your purposes, what you have on paper, you don't have to describe them that way. Programs don't have to say, okay, this is policy and this is procedure. That's just how my brain thinks about things. And I think it's helpful to talk about both kind of separately. But again, what you have written down on paper for your policy or it doesn't have to say, okay, this is policy, this is procedure. So what we're looking for here is, how does the program do it? When or how often does the program do it? Where is it documented? Who, meaning what position does that? And so we've got a whole list here of what would be part of 8.01. Describe the process of linking children and families to health services. Describe the process of screening, informing about postpartum depression, and connecting to available support and treatment services for mothers enrolled in the program. Questions that you might want to answer in that is like, what tool is used? How often is the screening done? Per the standard, it should be used with both. And we'll get into this, but the screening, depression screening, is for both 8.01 and 8.02. So it's going to be both expectant and recent mothers. And you'll see that as we move into 8.02. And how are mothers informed about postpartum depression? How are referrals made? How are they followed up on? Describe which positions link the children and families to health services. Maybe, maybe the home visitor, or maybe, something is noted as a possible need at intake by a supervisor, but who's then responsible for the actual linking or, connecting those families. How is that done? Describe common examples of each kind or type or category of, and really I'm saying bullet points there, of each type of health service for the program service area. So, there's not always going to be a comprehensive list. And there is, usually there's like a resource guide or something like that you could use there. But in your policy, you don't have to describe all of them. But you could certainly include some ones that are like provide multiple services, or you could refer to your community resource guide or whatever, that document might be to reference parent educators or family support staff to like where to go to get some of that information. Maybe there's one that your organization partners with quite a bit. And so maybe that's an appropriate thing to list in there. It all depends on the structure of the program. Describe the documentation of linking the family to the health services. Again, from that initial, I made the referral, or I told them, that family, about that, to that. Did they accept it? Did the family access it? Did they need help accessing it? What was that final outcome? Should walk all the way through the process. And then where is that documented? Is it documented in the case notes, a referral log, a contact log? Where, how does that, where would a peer reviewer, where would somebody who wasn't familiar with the program that was doing, an audit, how would they know, kind of beyond that, like we told them about it, how would they know if that family benefited from that or if they accessed it? And that's a question we find ourselves asking a lot in TAs, like, okay, yep, you do it. How is somebody going to know you do it? And sometimes that comes from, what's in the participant files, what, is documented there. Sometimes it'll come from a panel interview. You don't have to have everything documented. You don't have to, there's not a place on a form for everything. But in this case, with this kind of thing, it definitely should be on paper, because a family could be connected with multiple resources over the span of their, enrollment in a program. And so we want to see kind of all of those things. I do have an example here. It's really lengthy and involved. I like to write procedure that has like steps, like first step, second step, third step. That's not required, but it's how my brain works. And it's how I appreciate things to be if I were a staff in a program and I wanted to know exactly what my job would be. Um, it helps my way of thinking to have it written out like 1, 2, 3 kind of thing. Again, not required, just something that it's how I tend to think about things. So I included in here, that health resource connection procedure, and then I also have a depression screen procedure because that's, something that's a little bit, there's similarities, but not enough of them to. And then in the depression screen procedure, I did refer back to other procedures. Okay, so moving on to standard 8.02. This is going to be very similar to 8.01, except for that it's pertaining to expectant parents, that they are linked to the following healthcare services as needed. And these are different bullet points, but in terms of like how we set things up, it's going to be very similar. So we've got prenatal healthcare, genetic risk identification and counseling services, labor and delivery, nutrition, dental care, mental health care, postpartum care. And again, we talk in here about element, it's F on this one. Expectant mothers should be regularly screened for depression and connected to available supports. Also got down here in the interpretation, programs that serve any expectant parents are required to link those parents to appropriate resources. That would include programs that target expectant parents or programs that targets another population, but happens to include expectant parents. And I think for the most part, we're pretty good about including that one in there. We used to get a lot of questions about like, well, we don't really serve, pregnant moms, but we don't have many of them in our program. Are we required to do that? And really the answer is like, do you have moms in your program that might become pregnant? Well, yeah. So then yes, this needs to be included as well. Same definitions as before, so I'm not really going to go over those again. For the policy, these are very similar as well. Define all the kinds, types, and categories. So we've got, what does the program do? Why does the program do it? Describe all the kinds, types, or categories that of health services expected parents are linked to. At a minimum, you want to cover all of those bullet points in the standard, but certainly you could include more. Make sure you talk about depression screening. And again, linked is not just telling them about it. It's kind of that complete follow through. If the family wants help or wants to access the service, interested in that service, and then maybe even needs help accessing it. Policy example. I could recreate the policy for 8.01 and put it in here, but change everything to match 8.02. It's really going to be the same. Usually what we see in TA is programs have this kind of already merged together, and that's certainly an approach you could take, or you could have them split out. It is 100% up to you all. Procedure. Again, this is all very similar to 8.01. How does the program do it? When or how often does the program do this? Where is it documented? And who, like what position does it? Again, this is all pretty much the same. And procedure example, same thing. Very similar to 8.02. Again, for procedure, you could have it be part of, you could have health services for all families, and like linking health services to all families, and then health services for expectant parents. You could have those all merged together in one policy and procedure, or they could be separate, whatever the preference is for your program. Standard 8.03. Here's where things kind of it's a little different. Families are helped to sign up for health insurance when coverage is available. Is available? Yes. And receive information about other options for care, such as free clinics when insurance coverage is not available. So we'll dig into that one a little bit more here. There's no definitions for the standard that are specific that we really need to define to increase clarification. So the policy, what does the program do? Why do they do it? What does the program do as it relates to health insurance? What does the program do if health insurance is not available for a family? And why does the program help families access health insurance or other options when health insurance is not available? The why statement isn't always necessary or required, sometimes if I'm helping, a program tweak their policy, sometimes doing the why though helps you figure out the what. If you kind of acknowledge why something is important, then it helps you move into like, okay, now we talked about why health insurance is important to our program and to families. Now let's talk about what we're going to do or what we do about it, what we do to acknowledge it, I think, or talk about it. So the first, sorry, I had to get a drink. The first thing I would say here is if this is kind of like, if you're looking at the standard for, and you're saying, oh golly, like I don't know what our practices are, what we've got in place right now to address this. The first thing I would say is, how do you know? How do you know if a family member, again, whoever is defined, it's defined by the family, has access to health insurance? How do you know if the child or children either enrolled in the program or not enrolled in the program have access to health insurance? So if you're not currently asking this question, start asking that question. You're going to have to start getting this information from families. So if it's not on, a lot of times we see it on enrollment paperwork, but it could be on other things as well. So that's the first step in really addressing the standard, is finding out the status of health insurance for the family members and all of the family members. And a lot of times we focus on moms and target children, like the child that's enrolled in the program, but really we should be the standard. So we go back here, the standard talks about families, and so we're gonna it's all encompassing. It's whoever's included in that family. So if you've got, if the father is involved or is participating, or we need to check in on the status of dad. We need to check in on status of health insurance for older children that are maybe at school age. We want to be making sure that we're checking in and helping families about all of that. So there's my policy example. Procedure gets a little bit more in depth. How does the program do it? When or how often does the program do it? Where is it documented? Who or what position does? So how does the program determine if each family has health insurance? How is this information updated? When does the program ask about health insurance status? Which position gathers that information? Is it done? If it's done on intake, maybe it's a supervisor that initially captures it, but then what happens from there? Who's, kind of which position takes care of that, connecting them if necessary with a health insurance, or free clinics, or those other things as they may be. Where is each family member's health insurance status documented and updated? So a lot of times a lot of programs enroll mom while she's pregnant and maybe has access to Title 19, but then after she delivers the baby, maybe loses that access, and so we need to consider updating those things as well, because it might be necessary maybe every 6 months. Maybe if you have like every 6 months you do kind of like a update on the family's information to make sure you've got current information documented, like maybe health insurance is included in there. What is the protocol if a family member does not have health insurance? What referrals are made? How are they followed up on? Where is it all documented? What are some examples of resources available to the individuals who need help accessing health insurance? So if you've got a family that doesn't have it and is interested in it, what are some examples of resources that you can connect them with? What are some examples of resources available to individuals who need help accessing other options, such as like free clinics? Or community health clinics. Maybe I know in my hometown there's a dentist who I think it's probably once or twice a year, she does a free dental clinic. What are those examples of resources? Are all things that you could include in your procedure. Here's my policy example. I talked about in this, I did want to call attention to one thing. Oh, if health insurance is not available to the family due to income, employment status, sometimes immigration status affects that, or any other reason. So I wanted to kind of call it. I know a lot of times we think about like affordability being the reason that a family might not be able to access health insurance, but sometimes there are the other factors that come into play, and so we need to make sure we're talking about it in a way that considers all of those other options. Okay, so last standard for the day is standard 8.04. And here we're talking about families are educated about health-related issues and behaviors that can impact child, individual, and family functioning, and the prevention and treatment of diseases. And to me, those seem like very different issues. It seems odd that they're all kind of in the same standard, but we'll talk about them. For this one, we just got the definition of prevention, which I think is pretty self-explanatory. Actions taken to minimize or eliminate social, psychological, or other conditions. Prevention can occur at the individual, group, community, and societal levels, and enhances opportunities to achieve positive fulfillment. So policy here. What does the program do? Why does the program do it? What are families educated about relating to health-related issues in the program? Why is this important to the program? Here's kind of a very short example of a policy on that one. And sometimes policies are very short, and where you find a lot of like the definition is in that procedure piece. Right, this actually should be deleted. That doesn't belong on that page. Procedure. So here we're talking about how, when, how often, where, who. How does the program relate health issues to each individual family? How does the program present health-related topics to each family? So, some of those things might be based on your curriculum. If you've got some curriculum that really has a lot of information about that, those might be things you talk about. Maybe there's a whole section of that curriculum that talks about all those health-related issues, and so you could, in your policy, you could reference, that this is where we get a lot of that stuff from. If there's parent handouts or things, curriculum that you provide to give to families that like on some interval. So like at 6 months old, curriculum regarding baby proofing is provided to families. And then at XYZ months old, this is provided to families. It could be something like that. How you structure that is very much up to program design and what works best for your program and your organization and your community. How often do they do it? Does the program provide health-related topics to each family? Again, it's kind of goes back to just like, how is it? It shouldn't be just one and done. It shouldn't be just like, we're going to talk about this once and then never again. These are topics that change as the family's needs change, as children get older, those kinds of things. And so it should be continually enmeshed in program design, talking about these topics. Where does it get documented? Who presents the information? Typically, that stuff's going to come from a home visitor. It could be, though, that the program if there's a long-term home visitation program that has a group component where the group meets monthly, it could be that, you choose to take a topic of those group connections once a quarter is going to be related to a health topic. And so it could be the way you meet this one is by that. I would say in that one, though, what happens, how do the families that don't attend those group components, how do they get this information? So that's, I guess, something to think of, and that's kind of a tangent to go down, but it could be that programs could include that in here as well. Oops, I'm clicking through this too fast. Let me go back. Again, here's a procedure, and this procedure example, and this one it is done quarterly. It's a conversation that occurs quarterly, and then it's all documented in case files, and even included under which tab in the case file they would find those forms that contain all of the documentation of the health related topics that were covered. Okay, so now we are at the time for questions, comments, concerns, anything anyone has here that they want to lift up or talk about related to this topic or to this standard. Can feel free to unmute and just jump in or type in the chat. It's up to you.
We have come across a few, just a handful of families who have become very anti-vaccination. And obviously, as part of the standard, that's something we should be educating about. Do you have any good resources, or anybody have any good resources that you're using?
Yeah, I think I would open that up. I'm not, in terms of that specific example, I'm not probably the expert. So if anybody has anything that they're using in that would be wonderful to lift up. Or another good place for you, Amy, on that might be to put that out in the Family Support Professionals Facebook group to see if anybody else has something that they've used with families that are vaccine hesitant.
I didn't know there was an FSP Professionals. Is there a specific name?
Yeah, it is. I can't think of the name of it. It's like Iowa Family Support Professionals.
Okay.
I don't know the exact name of it.
I'll search for it.
Yeah, it's a pretty big group. There's like several hundred people in the group. And
Okay.
every once in a while I do see things like where people are looking for something like that. So that might be a good resource for you.
Thank you.
Yeah, you're welcome. Anyone else have any questions? Okie doke. Well, the other last minute plug I would say is here's all of our contact information. We have our website, we have a Facebook page, and then we do have a YouTube channel where all of these webinars, the recorded webinars, go to live. So if there's anything you want to go and look up on previous webinars, right now we're going through all of the standards. So we've just done standard 8. So if you have a question on like standard 2, you could certainly go back and watch the webinar on standard 2 if you wanted to get more information about that one. The other thing I'll say is that we're going to start to do like a quarterly webinar for new supervisors to kind of get them familiar with the standards, familiar with the Iowa Family Support Credential, and I would look for that to kick off. We'll do it next quarter, the quarter starts in April. So April, May, or June, we'll start that as well. And then as a way just kind of to provide that connection with other supervisors that are new and entering the world of the Iowa Family Support Credential and what it has or what we do. And people can participate for as long as they want until they don't consider themselves new anymore. It's not like you can just go to one and then be done. Participate for a year of them if you need to, or whatever the need might be. And then there's our contact information. Feel free to reach out at any point in time with any questions that you have about anything. All right, well, thanks for joining us today, and I will get this out, the link for the slides and the link to view the webinar again. Thank you.